Yes, thank you, Yvonne. Look, Social Security is incredibly important for seniors here in the United States, especially here in my district, and I understand that very well. I saw my mother contributing to her Social Security, and it's something that she relies on now that she's 81 years old. I have been in Congress advocating to ensure that we maintain Social Security benefits and the program solvent, which is why I sponsored legislation to support this, so that we take all the measures to keep Social Security solvent through 2100. So, the year 2100. Imagine it seems long, a long time from now, but we need to ensure that seniors can rely on their Social Security benefits. So while I'm in Congress, I'm going to do everything in my power in the House to protect Social Security. What we've seen is that seniors are paying more and more for their prescription drugs. I sponsored legislation, several pieces of legislation, one of them, HR3, which would lower prescription drug prices, but also makes sure that seniors, that there's a cap on what they're paying into their Medicare Part D Advantage program. So we passed this in the House of Representatives so that those costs are reduced. We cannot allow drug companies to continue to monopolize prescription drugs that are so much needed for seniors over the age of 60. We know that they start relying on medication just to maintain their health. So this is a critical piece of legislation that we did pass. I was one of the co-sponsors and we passed in the House. So it's something critical that we need to put pressure on the Senate for them to take on, and that's HR3. Yes, Yvonne, this has been an unprecedented crisis. And like you've said, seniors have been disproportionately affected. Their mortality rates are higher. And so, one of the things that I did do is introduce and wrote a bill that would require Medicare Advantage recipients to, for their treatment of COVID, to be fully covered. And this was included in the HEROES Act. We have to ensure that we provide economic relief to those affected the most by this virus. That is why in the House back in May, we passed the HEROES. We just this week again passed a revised bill to include economic relief for those that need it the most, another round of stimulus payments of $1,200, extending unemployment benefits, providing coverage for health care for seniors that rely heavily not only on Medicare, but just to get their health care through the ACA, many of them. And unfortunately, what we've seen is that the Republicans in the Senate are blocking every attempt, but we have to act, and we have to act now by providing this economic relief. It's the only way that these families and our seniors will be able to come out of this crisis, not just this serious health crisis for so many of them, but also an economic crisis. Yes, Yvonne, this is exactly the bill that I was mentioning before, HR3. Right now, Medicare cannot negotiate the price of prescription drug prices. And this was something that was passed into law when the Republicans had a hold in the House and in the Senate, a few years ago. So what we did is we passed in the House a piece of legislation that would allow Medicare to negotiate these prescription drugs, especially for the top 10 drugs that are mostly used in the United States: insulin, medication for asthma, for those people that suffer from asthma. Now, one of the things that I did in the Judiciary Committee is I introduced a piece of legislation with a Republican. It's a bipartisan bill that would allow generic drug companies to participate in the marketplace. Big pharma, pharmaceutical companies right now use different tricks to control the patent of these drugs, which makes them unattainable and extremely expensive for seniors. So I will continue to do this if I'm elected. I think that there's so much work that needs to be done. That's why it's so important to continue, not just to keep me in Congress, to maintain the House, change the Senate, and pass these bills that our seniors are really right now in need of relief. Living here in Florida, one of the things that we saw is that the nursing homes were seeing cases of COVID spike up. That happened also at a nursing facility here in my district in Monroe County. I had to meet with families to hear them telling me stories that they knew there was COVID inside the nursing home or long-term care facilities, and they weren't getting the information from the facility themselves. They couldn't see their loved ones. They weren't getting the information that they were requesting. So I immediately wrote to the governor, requiring him to provide us with the information that we needed to keep our seniors safe in nursing homes, but also those people that need care in long-term facilities. There was a 30-year-old actually living in one of these facilities in Monroe County. So her parents were extremely concerned. We passed in the HEROES Act, and I keep saying, going back to the HEROES, because we really looked at what was happening with COVID in all these different areas. And what we included was to codify into law the requirement for nursing facilities and long-term facilities to provide all the numbers of COVID infections to the CDC so that there's full transparency, which currently there's guidance, but it's not the law. So they're not required to do so by law. We need to continue to provide funding for nursing homes so that they have the proper PPE equipment, and not just for this pandemic, but for them to receive the care that they need. So while I'm in Congress, Yvonne, I can tell you seniors are a priority for me. Like I said, my mother, who's 81, lives with me. And I have lived through some of the challenges that she's had, her health challenges, how expensive it is for her to get some of the services. So it's very personal to me, and my focus will continue to be to protect seniors' health care, economic relief, and other issues.